Mamas, it's your CajunStork here, and welcome to CajunStork Shorts. Today we're going to talk about a pretty commonly used intervention in birth called episiotomy. An episiotomy is when we use the scissors to cut the perineum to get the baby out quicker during delivery. Back in the 70s and the 80s and the 90s, and heck, I hate to admit it, but even still today, episiotomies are a pretty commonly used procedure in childbirth. It used to be standard, now it's just pretty common. But in midwifery practices, we only use episiotomies in the instance of a dire medical emergency where that 30 to 60 seconds we would gain by cutting the perineum would actually benefit the baby, whether improve their outcomes or even possibly save their life. Episiotomy should never be a routine intervention in birth, and in fact, I don't think scissors even belong at a birth. So, what I would encourage you to do to prevent getting an unnecessary episiotomy in labor would be to write on your birth plan, not that I prefer not to have an episiotomy, but rather I refuse episiotomy except in the instance of a dire medical emergency for my baby. You don't want an episiotomy if you are gonna tear anyway, or if it's 5 o'clock, or if the doctor has somewhere to be. This is a medical procedure that should only be used in a dire emergency for your baby. See you next week. Bye-bye.